I think we'll go ahead and get started this evening. I want to welcome you all to the Obesity Action Coalition's information session for the CMS Proposed Rule regarding coverage of obesity medications. My name is Sarah Bramblett. I'm the Senior Advocacy Manager for the Obesity Action Coalition. And my colleague, Tracy Svenvich, is also on here to help me, and she is the Director of Policy and Strategy for the Obesity Action Coalition. So just a quick agenda of what we're going to go over this evening. We're just going to give background of the issue. We're going to provide an overview of the proposed rule. And then we're going to also talk about submitting a public comment. We have some frequently asked questions that we'll go over, and then we'll also open it up for questions and answers. We will be using the Q&A feature. I don't know if the chat is active or not. I apologize, but we're going to try to keep everything within the Q&A so that we can better track the questions and make sure we're getting everyone an answer they need. I do want to also just state that we are recording this session. We will provide the recording. We will also provide the slides, and I have several other resources available that I will be sending out to everyone who is registered for this evening. I'll also be sending it out to our advocates and members overall, but that does include a one pager with this information on it. That does have the availability for people just to scan a QR code to be able to get information to submit their public comment. So a little bit of background on the issue. Most probably are aware of this. So under the current law, Medicare's prescription drug benefit, which is referred to as Part D, excludes agents when used for anorexia, weight loss, or weight gain. This exclusion has prevented Medicare from covering obesity medications and has allowed state Medicaid plans to opt out of providing such coverage. So there currently are some states that their Medicaid programs cover obesity medications, but more than 30%, close to 40%, do not provide such coverage. OAC and our advocacy partners have advocated for over a decade to have Medicare change the interpretation of the statute. And finally, our voices were heard. And on November 26th of 2024, just last year, the White House announced a proposed rule to expand coverage for obesity medications under both Medicare and Medicaid. It's a huge win for all of our advocates and anyone on the line who has helped us with that. Thank you. So overview of the proposed rule. So what the rule does is proposes a reinterpretation of the exclusionary language on weight loss. If finalized, medications for weight loss or chronic weight management for treating obesity would be covered. CMS, which is the Centers for Medicare and Medicaid Services, is seeking comments on whether to include coverage for individuals with overweight and at least one weight-related medical condition. So there's one area that they currently, the proposed rule doesn't guarantee coverage for individuals with overweight and at least one weight-related medical condition. That is an area that is certainly, if that applies to you or patients, that's something you want to include in your comments to provide feedback to CMS. Highlights of the proposed rule. So the rule does not define obesity by BMI. We all know BMI is not an accurate gauge of individual health. We are moving away from using that as a way to diagnose obesity. And so it's a highlight that the rule does not state that certain BMIs are what define obesity. Also, the Part D and Medicaid plans will be able to establish their own criteria for prior authorization. However, the criteria cannot be more restrictive than the prescribing indication criteria. So, these medications have specific indications and prescribing indications criteria. So a Part D or Medicaid plan cannot make their coverage more restrictive than what the prescribing criteria is. The most important thing is it acknowledges obesity as a chronic disease, and it emphasizes that patients will require ongoing therapy for effective treatment, and therefore patients will need continuous coverage for proper treatment. So, it won't allow for like prior authorizations every 6 months or something like that. That's just an example. That's not exactly spelled out, but as it acknowledges that this is something that patients might need on a long-term basis. So the next steps in the process now. So As with anything in the regulatory process, there's a 60-day public comment period. And that public comment period ends January 27th of 2025. Public comment period allows for all stakeholders to provide feedback on the proposed rule. And so the Part D and Medicaid coverage details are actually part of a larger proposed rule of, or I think close to 700, 900 pages. So this is just one section of that. So there'll be a lot of comments going in, and that is important when we get to regarding submitting your comments. Comments can be supportive and or critical of a proposed rule. We're hoping all your comments will be supportive of this aspect of the proposed rule and supportive of expanding this coverage for obesity treatments. All comments are read by CMS, and again, CMS is the Centers for Medicare and Medicaid Services. So that is, very important, and a reason why we do want everyone to submit a unique comment, because these will be read by CMS. They do take the time to go through all of them, but they will have eyes on them by a human being to read them. So that is why quality is the most effective. Quantity will make an impact. And I say this because a lot of the action items that OAC puts out there, we usually have a whole letter because it's going to Congress and people can just put their name, and we encourage people to personalize them. But I know a lot of people might be in a rush and just put their name on it and send it to their members of Congress or whoever we're sending it to at the time. Because a lot of times those offices are just keeping a tally of how many come in. Since these are really read and it's really important to make sure they're all unique, that quality is very important. It doesn't have to be, a lot, just from the heart, from your perspective, and how this change in policy will impact you. But we do want a lot of them also, because certainly we want a lot of comments to flood the comment section or the public comments. So CMS really hears from everyone who supports this change and why it is needed and why we want them to finalize the rule and make sure this coverage is implemented. And again, though, only one comment per individual entity may be submitted. So only one comment per person, but if you're part of an organization, the organization is putting a comment in, you can put a comment in yourself. So we encourage all organizations put one in from, speaking on behalf of the larger organization, but any individual or members of that organization, we also encourage everyone to submit a comment. So again, why you should submit a public comment. Again, public comments play a crucial role in shaping policy by making voices heard and contributing to meaningful change. We've already seen our voices heard by the administration. We had a large call to action earlier last year asking for the administration to take such action as they just recently took. Over the years, we've met with CMS and administrations asking for this to be done. And so finally, in November, they've made that change that we're asking for. Of course, again, through the process, it has to be a proposed rule, and then they get feedback and finalize it. So this is a significant milestone, and continuing to speak up, your voice can help ensure that access to obesity care for millions of Americans. Another thing, as much as this is for Medicare or Medicaid coverage, that policy sets the standard for other insurers, both private and public. So even if you're not currently a beneficiary of Medicare or Medicaid, this change in policy will still affect you in a positive way. It might not be immediate, but other insurers look to CMS as who sets the standards. So composing your public comment, we want to first express support for the reinterpretation of coverage for obesity medications. Share how the proposed policy change would impact you personally or professionally, or both. You want to be specific and include examples when available. State that you are commenting on the Part D and Medicaid section of the proposed rule. Again, it's going to be a larger rule. There's going to be a lot of other sections, so we want to make sure that when CMS reads this, they know exactly what part of the larger rule that you are commenting on. There's no minimum or maximum length for an effective comment. So again, it can be a few sentences, a small paragraph. Some of the organizations will submit letters. I myself know my personal one will likely be a letter and quite long. But yours doesn't have to be. It can just be very short and just share from the heart why this coverage is going to impact you. And again, the comment process is not a vote. One well-supported comment is often more influential than 1,000 form letters. And that's why we're going to give you instructions, and we do have a way to make it easier to submit it, but we want everyone to make sure they are putting their personal story and personal touch on the comments and making sure they're each unique. The key messages that you might want to also include in your comment is, just to state again, that obesity is a chronic disease and patients deserve access to comprehensive care, which includes nutrition therapy, physical activity, behavioral modification, and medical management, which is surgical and pharmacological. So this expanding access to obesity care just helps in that overall toolbox and toolkit of treatments that patients deserve access to for their chronic disease. And patients should not have to develop more serious medical conditions in order to have coverage for obesity medications. We all know that currently many of the medications are covered by Medicare or Medicaid for patients with diabetes. And now there's a couple additional indications, cardiovascular disease and obstructive sleep apnea. So while that opens up coverage for more individuals living with obesity, it still leaves out many individuals with obesity who deserve the same access to care. Coverage criteria set by plans should be similar to requirements for other disease states. And this just goes back to what we mentioned. CMS has stated that the coverage criteria that plans set should be the same in line with the indications of the prescription indications of the medication. So I just wanted to provide some sample public comments. So again, state the what so that you are commenting on the proposed rule in the section. I have it here. We also have it in our instructions and the form that we created. And then go right into the why you support the coverage for obesity medications. Are you a patient who needs them? Your doctor prescribed them. I'm a doctor who has many patients who would benefit from these medications. And then again, tell how the proposed change would impact you personally or professionally. And I just created some, examples. These aren't specific patients, but just some of the examples of what a patient situation might be. So the first one is that, I support coverage for obesity medications because I'm a Medicare beneficiary living with obesity with a strong family history of diabetes. My doctor prescribed a GLP-1, but my Part D plan would not cover it because I do not have a diagnosis of diabetes yet. I don't want to wait until my health gets worse and to be able to get treatments my doctor recommends. And the other one is from a perspective of someone who has a different insurance. I'm writing in support of CMS coverage of obesity medications. I've been taking a GLP-1 for 18 months. During this time, I've lost 50 pounds and no longer need to take medication for my blood pressure. I was just notified that my employer's insurance will no longer cover this medication, and I'm worried that having to stop this medication will reverse all health improvements I've made. So again, something as simple as this would be impactful. Just having the patients or you share, their experience if they'd like to have tried the medications, if they've tried medications and been denied. And I know something that's happening right now is a lot of patients have had access, and that access is being taken away by their insurance. You don't necessarily need to, you can say, please finalize this rule, but you don't necessarily need an ending. Both the forms, the way you submit it, will have another place for you to put your name and your information. So submitting your public comment, the deadline to submit public comments is January 27th, 2025 at 5 p.m. However, we're encouraging people to get them in before January 20th, just to make sure they, as many as possible, are in. We're not quite sure what's, the public comment period will stay open throughout the 27th, but just make sure we have them all in before administration changes. because there will be new incoming, HHS secretary and CMS leads. So the comments can be submitted online at regulations.gov, but OAC has also created a form in our Action Center to streamline the submission process to regulations.gov. So those both ways will still be going to the same place. Anyone who was on our previous webinar, the Action Center item is something we've created since then. We did want to make it a little easier for people, but we still want to make sure people know they need to compose their own aspect of the public comment to include in that form. OAC will provide step-by-step instructions on how to submit your comment on regulations.gov. And comments containing more than 5,000 characters should be submitted as an attached letter, and that must be done on the regulations.gov website. So if your organization or you an individual that are going to have a lengthy comment, and again, that's 5,000 characters, not 5,000 words. So if you do need to attach a letter, you'll need to use the instructions for submitting on the regulations.gov website. Comments will be visible to others, so be mindful of sharing any personal information within the comment. That's not to say you can't share your weight and whatnot, but you might not want to mention any insurance numbers or and such like that. And again, there's a separate section for the comments versus a section that asks you for your name or your contact information. And we do want to encourage all individuals living with obesity, healthcare providers, and organizations to submit comments on the proposed rule. They are public comments, public meaning anyone can submit, and I highly encourage everyone to submit and encourage anyone who wasn't able to make this webinar to also submit. So here is a screenshot of how you could submit your public comment through the Obesity Action Center. So again, we've made this form. We've put some tips for composing your public comment on the left. And then on the right is where you would actually click. We have a starter sentence for you that lists the section that you're commenting on and that you're supporting the CMS coverage. But it's imperative that people add more than that. If you click in that box, you can add more underneath that introductory paragraph. And your comment's going to be most effective if you click on that. If CMS only gets a bunch of comments with this paragraph, it's going to like count as one comment. They're just going to start ignoring them if they all say the same thing. If they all start with this but have additional, they'll consider those unique. And then you can see under that is where you put your email address and your name and information, and then hit the red submit your comment. So these are the instructions, what they look like for submitting your public comment on regulations.gov. So again, it's the same information collecting, it's just on regulations.gov, it's spread out a little bit more. So you just would go to the link, and when I supply the instructions, the link is there. So you go to the link of where the proposed rule is and click on comment. And again, there's an area where you can click in and you can type your comment there. I usually type mine somewhere else and then copy and paste it into that. And then again, there's just some other information they ask for. And as you can see, there's a place to attach files. If you're going to be attaching a letter, you can do so there. And then you need to select if you're an individual or your organization. There is a way that you can submit anonymously, and I understand that might be something that some individuals would like to do. We would highly encourage you to though submit under your name so that they know it's a real person behind the comment. And then, like most online forms, at the end, you click and make sure you're a live person and then hit submit. When you submit through the regulations.gov website, another benefit of doing it through this website is you have the option to click to receive you have the ability to click to receive a confirmation number and a tracking number so that you can see and go back and look at your comment once it is published online. So now I'm going to hand it over to Tracy to go over some frequently asked questions. As I mentioned in the beginning, because this is the question we often get, slides will be available as well as a recording. And some other resources that we will send out to everyone who was registered for today.
Thanks for that great information, Sarah, and thanks everyone for joining us this evening. Before you finish there, Sarah, there is one question in the Q&A in regards to, is there any benefit to commenting directly on regulations.gov versus via the OAC Action Center?
Yeah, so I feel one benefit is as we made the OAC Action Center streamline and maybe a little bit easier for people to follow, so that link we can share. But again, I think regulations.gov will kind of see that it comes from another source. And like I think the highlight is being able to get a tracking number and a confirmation that your comment did get in. So as far as another program I used with another organization when we did the Action Center type submission, and then even in the people who I've already had test our system, they got our confirmation, but they didn't get a confirmation from regulations.gov. So
thanks, Sarah. And I think also, just to add to that, it comes down to personal preference, and also, your level of comfort with submitting, a public comment like this. So either way is okay. It just options for OAC members and OAC advocacy partners. So here are a few other questions that we've received over the course of since the proposed rule was released. When would coverage begin? This is a two-part answer. The coverage would begin for the Medicare Part D side starting January 1, 2026. And the coverage for the Medicaid plans would begin, I believe is 60 days after the rule would be finalized. So if the rule is, the timeline for the rule is expected to be finalized late April, early May. So we would be looking at a summertime start for Medicaid coverage. And that's assuming if the rule is finalized, still including Section 4, which is the coverage for obesity medications. Another question we've received is, will all insurance have to cover obesity medications? So all Medicare Part D prescription drug plans would have to cover it, and all Medicaid, state Medicaid programs would have to cover it. It does not directly affect private insurance coverage. It does not directly affect if your employer provides insurance coverage. However, we do believe it will have an indirect effect, and over time, those types of health insurances will cover obesity medications as well. It's just that timing is somewhat uncertain. Another question we've had, after CMS finalizes the rule, do other branches of government have to take action? So once the rule is finalized, yes, then state Medicaid programs would have to implement the coverage, and Medicare plans would have to implement the coverage. During the review process, there are a couple different agencies that look at the proposed rule as it's going through its finalization steps. The Office of Management and Budget is one of them, as well as obviously other departments under HHS. How much would the Medicare Part D copay be? That is all dependent on which Medicare Part D plan a beneficiary has. So each plan would have different deductible, co-insurance, copay structure. So that would be an individualized answer. You'd have to check with your benefit, check into your benefit design on that one. I will say though, in regards to the Medicare Part D coverage and cost, in 2025 and subsequently in 2026, the Medicare donut hole has closed, and now there will be a maximum out-of-pocket limit at $2,000 per year. So that can help affordability to some extent. Another question, is there any possibility of coverage to be implemented in 2025? Yes, for Medicaid, potentially, depending on the timing of finalizing the rule. However, on the Medicare Part D side, it would be, we'd be looking at the January 2026 timeframe. Where can I read the proposed rule? It's available on regulations.gov. Sarah will follow up with that resource for everyone. And what about intensive behavioral therapy, IBT, and Part B? This rule does not reference or include the Part B ambulatory care side of evidence-based obesity care. So it is specific to medications. However, through other advocacy efforts, OAC and many of our partners, including all of the OCAN coalition, we are separately advocating to update and improve intensive behavioral therapy as well, because as we all know, comprehensive care is best for health outcomes. And then lastly, what about the Treat and Reduce Obesity Act? So we do expect the Treat and Reduce Obesity Act to be reintroduced in this new Congress, as it has just kicked off. We don't have any specifics yet on timing, on when that will be. We are looking for two new bill champions or sponsors, one in the Senate and also one in the House, due to member retirements. So we are involved in monitoring who those new champions and sponsors will be for the bill. And once those are named, we'll be able to start meeting with those offices and get a better sense of what the timing will look like for reintroduction. If the proposed rule is finalized, that is a fantastic policy win and update for obesity care. However, we still want to see TROA, the Treat and Reduce Obesity Act, passed, because it would codify or make permanent that final rule. The final rule is, again, great. However, it technically is subject to change if there's a change in administration. So we need the legislation to formally change the law. So we're gonna advocate for both. We're gonna continue to advocate for both. Okay, great. I see we've got a bunch of other fantastic questions coming in. I did answer a few questions during the presentation. I hope those questions were helpful. Sarah, I don't know if there's a particular one you think we should start with. I haven't had a chance to run through all these yet.
I have not necessarily, let me see.
All good.
Yeah, I'm seeing that some of them are ones that you have touched on.
Yeah.
Yeah, especially I will just share, because I'm very open. I'm not only a policy person, I'm also a patient on Medicare. And I previously had Extra Help, which is the benefit to reduce the cost of Part D. And I had a very reasonable copay for my GLP-1. And this month, that copay was not so reasonable. But I did confirm with my Part D plan that it was going towards that $2,000 cap. So for the year, that is reasonable. And actually, my Plan D offered a payment plan. So there are some reasonable ways to make that more affordable for patients, until we are able to actually get other things to make it more affordable.
Thank you, Sarah. That actually addresses, I think,
A lot of
few
it.
of the questions,
Yes.
a few of the questions that came in on affordability, and also in regards to the $2,000 out-of-pocket maximum under Part D. So that's super helpful. So yes, we would expect, if coverage is finalized, for the obesity medications to fall within that out-of-pocket maximum. Another question, how will a change in administration potentially affect this possibility? Yes, so we've been tracking tracking who the potential nominees for the new Secretary of HHS, as well as the administrator for CMS, will be, both with Kennedy and Oz. There has been some supportive statements from Dr. Oz, and some some mixed messaging from nominee Kennedy. However, there was that he shared that said that medications have a place in the treatment and care for obesity. So that was helpful. Now, in regards to the rule moving along in the rulemaking process, we do expect this rule to continue through kind of standard process, because the rule is broader than the obesity medication provision, and there are certain parts of the proposed rule that include setting the Medicare Part D plans for that next plan year. So those things have to get done. So we expect the proposed rule in full to move along. The question mark is whether or not we can garner and create enough support around that Section 4 to keep the obesity medication coverage provision in there. We want that to stay in as the proposed rule finalizes. And again, that time frame we're looking at is end of April, early May. So we do expect this rule to be finalized. A new administration can come in and freeze rules or take a long time in reviewing them, kind of hold them up, or sometimes work them through. So yes, there is some variability and uncertainty when a new administration comes in. But for this particular proposed rule, we do believe that it will proceed. We just want to ensure that the medication provision stays in there. Great question here. It is not clear on the regulations.gov site what notice specifically we comment on. Is it Part D? We'll follow up specifically with the title of the full proposed rule, so you know exactly which one includes the obesity medication provision. You are correct. The title of the full proposed rule does not specifically call out obesity medications. So we will ensure that you have that as a reference point.
Yes, we'll provide direct links to the docket and document to make the comment on.
All right, I think we answered another new administration question there. Let's see, what can we go to next?
There's a question about supplemental insurance.
Yeah, Medicare Part or prescription drug plan would, coverage for obesity medications would be included under whichever prescription drug plan you have for Medicare Part D. I'd probably need a little bit more information on specifically which supplemental you're referencing, and so feel free to follow up with us on that one. Yes, actually, someone has shared here the full title of the proposed rule that would be the one that we would comment to. So it's got a long title: Medicare and Medicaid Programs, Contract Year 2026, Policy and Technical Changes to Medicare Advantage Program, Medicare Prescription Drug Benefit Program, Medicare Cost Plan Program, and programs of all-inclusive care for the elderly. So you can see that there are a lot of parts to this proposed rule, and the obesity medication provision is just one small part of it. Another question here: what stage is TROA at in terms of the legislative process? So given the new Congress, we are now starting the 119th Congress. We have gone back to the drawing board, essentially, where the bill will have to be reintroduced. And again, we are looking for 2 new sponsors, both one in the House and one in the Senate. So yes, we're kind of going back to the starting point. However, given the growing support, recognition, and urgency around wanting to take action on this issue, once it's reintroduced, we do feel we'll be in a good position to kind of go out strong and start build the support back up quickly. So we're not starting kind of from square one, but we do the legislative process has to start over again.
And Tracy, if I can just comment on that, for anyone
Yeah.
who might have, if people are aware, last congressional session and last year was the first time TROA had ever received a hearing in a committee and got passed out of committee with overwhelming bipartisan support. The only votes against it in the committee were actually because they wanted broader coverage from what was being proposed to change in it. I know as a patient listening to that hearing and listening to everyone in support of having access to care for patients with obesity was just such a change from, say, 10 years ago when I started advocating for this bill. And then on the Senate side, although there wasn't a Senate Finance Committee hearing, there were some Senate hearings regarding drug pricing. And so the topic was still heard in a committee setting on the Senate side. And it was the same. You didn't hear anyone, say patients don't need, access to these medications. Everyone was on board with getting patients access to these medications. It was just how are we going to do it? And again, the discussion of cost, which we know is out there and being worked on too. So as Tracy mentioned, we're not starting back at square one because we have made so many accomplishments and advancements and met so many important milestones in that legislative process and in the regulatory process too.
Thanks, Sarah. I'm going to jump to another TROA-related question since we're on that topic. And in regards to the behavioral health component, would TROA address the gap in nutrition coverage too? And yes, TROA has the provision for Medicare Part B intensive behavioral therapy, and it corrects kind of two of the policy issues with intensive behavioral therapy that we see today. One being that there are very limited types of qualified healthcare providers that can deliver the service, as well as where the service can be provided, the setting of care. So the Treat and Reduce Obesity Act would expand the types of providers that can work with patients and deliver intensive behavioral therapy, as well as where that can take place. There was so thanks for that question. Another question about who would we anticipate might oppose this proposed rule, and there are a couple of groups potentially that have raised concern. One being some of the health insurance companies, some of the insurance carriers, and secondly, the Medicaid, the state Medicaid plans have expressed some concern in regards to how it could affect the state budgets, and there are some ideas that we have, and our advocacy community more broadly have, on how that could be addressed. So we're seeking to work with the state Medicaid plans as well. But those are a couple that we do expect to potentially raise some opposition. Great. And
I'll
then there's
take the question. Oh, sorry.
Yeah,
I was just going to address the question regarding if not having to be an OAC member to get this information. Absolutely not. We welcome everyone to become an OAC member, but of course this webinar was open to everyone. We shared it with many of our advocacy partners. And so no, you don't have to be an OAC member in order to get this information. Again, I will send it out to anyone who was even registered, because I know some people might not have been able to attend tonight. So anyone who registered will certainly get it right away. And then I also plan on sending it out to people who are already in our system to receive advocacy notices. And we'll be also sharing a lot on social media. So we are, please, we want everyone and anyone who supports the expanding coverage for obesity medications to submit a public comment regardless of if they are OAC members. But we would encourage you to learn more about OAC and join us if you're interested.
Thanks, Sarah. Okay. That's most of the questions. There was one somewhat unrelated question in regards to a different Medicare program, the Medicare drug price negotiation program under the Inflation Reduction Act. So those are separate issues. We are tracking to see if whether or not one of the newer obesity medications might be included or for under review in the next round. We're following that and keeping a close eye on that. And part of the question is, if so, how do you think that could impact this rule or other coverage of obesity meds? Again, it doesn't have a necessarily a direct effect on this rule. I think that if one of the obesity meds would be included on the next list of drugs for negotiation, everyone would be monitoring it on how it would affect price and cost, kind of across. It could adjust some of those factors across the market. So yeah, we're definitely monitoring and tracking that as well. Great question. Okay, I think we've hit most of them, Sarah. Turn it back over to you.
Okay. I know I was busy clicking things. So again, thanks everyone for being here. And so I did just want to say we are here to help compose your comment if you have any questions. Some people have already in the Q&A section submitted some of the issues that they've had. And honestly, you could copy and paste that into your comment to CMS. That's exactly the type of things they need to hear, that you've been on it and you've lost coverage and you were doing well, and such. So I've seen some of I see the information that comes in through the emails we receive in our advocacy emails. Again, it can be very short. Organizations can send letters, but it can be very brief as a patient. It can be long, it can be brief, whichever you want. But if you do have questions on how to submit, and again, I'm going to send all those resources out either this evening or first thing in the morning, you can contact us at advocacy@obesityaction.org. Or reply to any of the emails that you've received regarding this from our advocacy website, or when I send you out the email, it'll have my Obesity Action email address. You can feel free to reply to that. Tracy, I think there was a question like asking what opportunity were for certain either certain board members or certain organizations. So I'm not quite sure in what regards, but again, anyone can submit a comment in regards to this. And if it's something where you want to get more involved in other aspects of what we're doing, you can certainly contact us at this email address also. Tracy, do you have anything else?
No, this was fantastic. Thank you all for joining us tonight. And Sarah, you did a great job sharing this information, and really looking forward to you all, including your voices in this really important advocacy opportunity. This is one of the most significant policy reforms, if finalized, that could affect our community of people living with obesity. So we really encourage you to share your voice. Thank you so much.
I just wanted to mention, because I mentioned resources. So on our previous webinar, someone asked about having the one pager with a QR code. So any healthcare providers out there, I will be sending out a one pager, which is a one page of information, but we're going to have a QR code. So if you have patients that are coming in and this impacts them, they can just scan the QR code with their phone and it'll take them to our action center so that they can take action. So we'd encourage you to encourage any of your patients that are impacted by this to do that and take action. Okay, and we had over 100 people on this evening. Great turnout. I'm very pleased of the interest in just not only the webinar, and I'm not I'm not only following up with the resources, but we will also be sending out reminders as the deadline approaches, reminding people that they have, I haven't set them up yet, but that you have a week, or I definitely will probably have the 24-hour notice, so that people can have reminders to get those comments in. And we would encourage them to get them in by January 20th, but the first comment and the last comment will all count the same, just as long as they're in by the deadline. So thank you all again. Thank you, Tracy, for joining me tonight, and look forward to additional advocacy opportunities with everyone. Thank you.